My presentation is on phenylketonuria, PKU. Phenylketonuria is a genetic disease caused by mutation of the PAH gene. It is an autosomal recessive disease that causes the inactivation of the enzyme that breaks down phenylalanine into tyrosine. Symptoms that can present include seizures, hyperactivity, spastic muscles, skin condition, and musty odor of breath, skin, or urine. If left untreated, phenylalanine is not broken down, builds up in the brain, and restricts normal brain enzyme activity, leading to severe irreversible brain damage. If a woman with untreated PKU becomes pregnant, she can have babies with congenital heart disease, microcephaly, growth retardation, and intellectual disabilities. However, with treatment, including strict adherence to a PKU diet, monitoring of phenylalanine and tyrosine levels, and medications as necessary, the mother can have normal pregnancies and a normal outcome for the fetus. Some statistics for PKU in the United States are approximately 16,000 people living in the United States have PKU. About 1 in 50 is a carrier. About 1 in 2,500 births results from two carriers having a baby. About 1/4 of babies born to two PKU carriers will have PKU. Between 1 in 10,000 and 1 in 15,000 births in the United States result in a child with PKU. This amounts to about 250 babies born with PKU each year in the United States. PKU is the result of a defect on chromosome 12, specifically on the long leg at 12q13.12. Mutations of this gene average 62% missense, 13% deletion, 11% splice, 6% silent, 5% nonsense, and 2% insertion. Classifications of the disease. Complete enzyme deficiency results in classic PKU, in which serum phenylalanine plasma concentrations in an untreated newly diagnosed newborn infant exceed 1,200 micromoles per liter. The following are all residual enzyme activity. Moderate PKU with a phenylalanine concentrations of 900 to 1,200 micromoles per liter. Mild PKU, phenylalanine concentrations 600 to 900 micromoles per liter. Mild hyperphenylalaninnemia, HPA, where your phenylalanine concentrations are 360 to 600 micromoles per liter, or benign mild HPA that typically does not require treatment with phenylalanine concentrations 120 to 360 micromoles per liter. This is an autosomal recessive disease, which means it has an autosomal recessive inheritance pattern that requires two recessive genes, one from each parent, for the disease to be expressed. The way this happens is if both parents are carriers of the recessive genes, or one or both parents have the disease. The graphic here shows how it will be expressed when one parent is a carrier, or both parents are a carrier. One parent is a carrier, then on average 50% of the offspring will be carriers, and 50% will not have the disease. When both parents are carriers, on average 25% will have the disease, 50% will be carriers, and 25% will not have the disease. Screening for PKU is performed 24 hours after birth on the newborn. A heel stick is performed, and the blood collected is placed on a special paper that is examined in the lab. A positive test will result in additional testing to verify the results. Treatment for the newborn with PKU includes breast milk with Lofenac formula, dietary management with low-protein foods, monitoring of phenylalanine levels, and medication for the disease used in conjunction with PKU meal plan if required. Careful management of the disease using diet, monitoring, and medications can result in an independent life. Normal IQ and patterns of behavior are likely. Normal offspring can result from pregnancies. However, genetic counseling should be provided to inform prospective parents of risk factors and management of PKU during pregnancies. Here's my list of references. And thank you for the opportunity to provide this presentation.